Board members are present except Dr. Ron McMary and and Sam Jones. Let us all stand for a moment of silent prayer in remembrance of those who have lost loved ones in the hill country, and thank all of those first responders, because it could very easily be us. Amen. Demetrius, would you lead us in prayer?
Oh yes, Heavenly Father, we thank you for this time to come together and make good choices for our citizens. Father, please guide and direct our decisions as we try to make the best one. In Jesus' name we pray, amen.
Amen. Certainly we want to welcome all of you that have come to our monthly hospital district and foundation board meeting. On behalf of all of our board members, we say welcome. We do have a quorum. Public comments.
Go ahead, Larry.
Larry, yo, come on. Steve, yo, come on.
That might be put on the spot.
100%, you just put me on the spot.
Hey, you're not joking, you do it.
Let's go to, this is Larry Fulham from the Sheriff Department.
Chief Deputy.
He's here along with Steve.
Talk about
And
the jail
certainly-
for this.
Yeah.
Yes, forgive me on my lack of knowledge on this. We just took office January 1st. Chuck Havert's the sheriff. He's at the sheriff's conference in Fort Worth this week. I'm sure you see it all over social media.
Yeah.
So he asked me to step in here and talk to y'all about something that I know very little about. So please forgive me on that. I do know, from what I understand, is y'all assist our sheriff's office
Yes.
with a monetary contribution towards the health care, and that is more appreciated than you'll ever understand. We're using as many resources as we can to not ask our taxpayers and our county commissioners we need. In the past 3 weeks, we've had 2 air conditions go out at $15,000 apiece. We've had a hot water heater go out at $15,000. And to run a jail it's a city within a little brick wall. And that we're committed to taking care of everybody that comes into our possession. And any help y'all can give us or continue to give us is 100% appreciated. And we're being very fiscally responsible with every penny that comes in. We feed on any given day 140 inmates, and we're only given $120,000 a year. And when you do the math on all that, it's about 78 cents a meal that we have allocated to feed our inmates. And if it wasn't for Walmart, Dollar Store, the food bank giving us overages, we couldn't do it. And then we'd be back in Commissioner's Court and back to the community asking for more help, like you've seen the money that we raised recently for the boat. That was because of the outpour from the community on where they want to see us. There's 3 game wardens in this county. They spend a lot of time on the border, the troopers on the border, and then ultimately it falls on the sheriff and the sheriff's office as a responsibility on all these waterways. So we asked our community to step up and help us with something that we just cannot afford. And within 36 hours, we raised the money to put a boat on Rayburn, Danby, the Natchez River, that runs all the way to Evadale. And we're so grateful to the community stepping up, helping us with that. And when it comes to y'all, there are just no words how much we appreciate y'all helping us, because it helps our community.
Yes.
That people make mistakes and they go to jail. Well, we have a godly responsibility to take care of every human being that comes in our possession and feeding them, clothing them, medical. And the young lady that we have over there now does as much as she can during the day. And if it wasn't for y'all, I don't know how we would do it.
Larry, let me ask you something. How many prisoners do y'all have from other counties?
Oh, gosh, it varies. Right now, we have 15 from Liberty County. On any given day, we have a contract with Alabama Coshada. So we're in a contract with them, so when they call and say, hey, we have one, the Indian Reservation over in Polk County. So 15 from Liberty, 1 or 2 on any given day from Alabama Coshada, 3 or 4 on any given day from Tyler County, 5 or 6 on any given day from Newton County. And again, if it wasn't for us being in a position to house out-of-county inmates, we wouldn't have the money to fix an air condition, because we charge those other counties a fee to house their inmate, and which offsets the price or the cost for a jailer that the county has to hire, the food, anywhere from 15 to 20, 25, because it's constantly fluctuating on, they got court, then we bring them back to Polk County or Newton County.
So Jamie, are we allowed to ask questions right now since?
Sure.
Yes.
Okay, so one of the things that what we have asked for in the past,
Yes, ma'am.
that, cause I am a huge proponent of supporting you guys, okay? But I know that some of our board members ask about the indigent program and how that works, and how the bills, the medical bills flow through the sheriff's department, and how y'all determine what portion, what area pays it. Did they fall under indigent? Are they precinct 1 or 2 inmates that, you know, we would be responsible for somewhat? I mean, there was a lot of questions about that, but I think we gave 125,000 last year, didn't we?
We didn't give anything
Last
last
year,
year.
the year before.
We
We
did.
gave 125.
So the 125,000, what we did with that was it just went directly to your contract to make sure that you had a 24-hour nurse.
Right.
So, and it was just a question about, you know, how does that bill, how does the medical bill come through your sheriff's department, your jail, and through your billing department?
We have a young lady that is on staff through a company, and I just went blank south. I just
It's the
went
one
blank
that y'all
on the name
had
of
for a
the
couple of
company.
years. It's the same one y'all had for a couple of years.
Yes, ma'am, yes.
3 years, I think y'all had.
So she's a contract employee. She's there from 8 to 4:30 or 5 o'clock every day. When we're finding we need somebody there 24 hours a day, but we're doing what we can.
Mhm.
Because some people have medicine that has to be given out at dinner time. Well, if we only give dinner at 6 to 7, she leaves at 4, because that's what her contract is, from 8 in the morning to 4. So we're trying to fill in the gaps there.
Is that 7 days a week?
It's on paper for 7 days a
But
week.
they're not providing that.
No, sir. No, sir.
That was an issue, I know.
100%. 100%.
Laura, Dr. Pham had met with Chuck, and they talked about the what ifs with us providing some of that. But Dr. Pham wasn't comfortable with it. Correct me if I'm wrong here, Dr. Pham, just not right now, because we've got all this clinic stuff.
Well, it's just such a big undertaking.
It is.
My recommendation is that we somehow work with Christus, because we have that pharmaceutical program that we do through the hospital, and if a inmate would go through the clinic, through the Christus clinic or through the hospital, and they're seen there, then their medication could be gotten through that,
340B.
yes, through that plan, and it would cut your cost. Now, I don't know, and then we would be keeping our money here, you know? I don't know, you would get with our hospital, director over there, or president,
Right. We just met.
and just look at that and see if it could possibly be worked out.
Absolutely.
But, I mean, it's just one, I mean, Dr. Pham would be ideal, but we just don't have our clinics are just not up and running like that yet.
Do you have a physician who is considered the physician for the jail that takes care of all the inmates?
I don't have that answer.
That's through the
That's through the
contract.
contract.
Is it, I would assume that it was through that contract, because she has to answer to somebody as an LVN or RN. She's gotta answer to somebody, and I think it's through that
I
contract.
think Dr.
I don't know who that
Bigfield
person
years
is.
ago saw them.
He did.
He used to do it a long time ago.
What about the county health?
We've had a concern, ma'am,
What about the county health doctor?
Who's the county health
Who
doctor?
is it over the, Jasper Newton Health Department?
Okay.
No, I
I
don't.
don't think we have one right
We've had a concern with a civilian handing medicine to an inmate, where, in my opinion, why shouldn't it be a medical professional
Correct.
that is handling the medicine that's pre-bagged, but still, we look at it as the liability of, I'm handing it to our jailer to handle the evening shift and handle meds that they're not a medical professional.
So
And
is that an LVN that you have that works from 8 to 4? Is that an LVN?
Yes, ma'am,
And
that's
she
handing
works for
it,
whoever it is that is our
that goes home
contract.
around 4:30 every day, but when, like we said, when they have dinner, a lot of people have their dinner time medicine, that we have jailers handing out the medicine. And I don't feel comfortable with that, but we're doing what we can.
And so the person you have a contract with doesn't have responsibility to cover that?
They're there between the hours that they're paid.
Well, when we gave the money, I think we did it 3 times.
I believe so.
The goal was, the last time that we did it, was to make sure that you guys had that 24-hour nurse, 24/7.
I think they're saying that they're available.
Yeah.
But not there.
Probably tell them.
Well.
Yeah.
now. I do know used to, it was RNs that worked at the county, not an LVN.
Right. I
Because
believe she is an LVN.
She's an LVN.
Yeah,
She's an LVN. She's an LVN.
Uh,
I'm kinda wondering what happened to that, because RNs can do a little bit more
Right.
than the LVNs can.
And then the 24-hour coverage also helps us with medical emergencies, that can be looked at and triaged there, because we have fights, unfortunately, in those cells, and they get bumps and bruises, and we could have a pretty quick assessment by a medical professional versus me, or one of our staff members that's not a medical professional.
And now they're taking them to the ER, correct?
We're taking them to the, calling an ambulance and having them picked up.
So whoever we have a contract with will supply a nurse 24 hours, but can't find one, we can't find them?
That would be up to that company that
It's up
provides
to
them.
the contract people, and they haven't chosen to do that.
I did talk to
Yes.
Chuck yesterday, and he is gonna come to next month's meeting. Rodney and I both forgot that he wanted to talk to us about this month. We forgot to put it on the agenda, but I asked him to come to next month's meeting, and he said he would. And he'll try to have a lot of this stuff answered, I think.
And one other thing that I had recommended, and that was that, you and I talked about it, and, Demetrios and I had talked about, when you all negotiate with that company, have one of the board members there with you.
Yes, sir.
And, when we put it on the agenda, it's gonna be my recommendation that Demetrios sit in on that negotiation.
Would love that, especially with y'all's expertise in the medical field and the hospital. Cause sometimes we have an infirmary, a hospital in our jail, and you know what I'm saying, is a room designated to have people triaged and blood pressure and all that.
Do y'all have that now?
We do have that, yes ma'am,
But no nurses.
from 8 to 5.
Monday through Friday.
But we're a 24/7 operation.
What will your jail population go to with the remodel?
We're at 140, I think we're at, jail standard says we can hold 147 now, and, it's 161 when we add the additional beds.
And that's forthcoming, right?
Yes, sir, that's in the May, the judge and the commissioners approved the contractor yesterday at Commissioners Court. So we're gonna be able to add 14 more beds, and, that's gonna be,
So obviously the demand's just gonna get greater.
yes, sir.
But what's the limit of time that the county can hold a detainee?
Ma'am?
What's the limit of time that the county can hold a detainee before the state has to take them, or?
We have some in there that have been there 300 days, it just depends. If we have a parolee and TDC is running behind on trying to come get them, they could be there 100 days. And it depends on the docket, the case law, the log at the DA's office on how quick they can run people through the system. So we have people there for months and months. They are residents of the Jasper County Jail at 101 Burge.
None of those people can get on Medicaid, can they?
Mark Hearn was in there 4 years.
Can they get on Medicaid?
I want to make a few points, and the contract that the county has is through a company that provides specific care for inmates, and this company has had a wealth of experience dealing with the laws and all the ins and outs of providing medical care for this population. Those rules and regulations are very unique to the penitentiary, and it's not something that's easily adaptable to civilian care. And that was the problem I had with trying to help the county out, was because we were taking on a much broader scope of responsibility of things that I'm not familiar with in terms of the laws pertaining to care of the inmates. The contract also provides the LVN, but the prices are negotiated to allow her to be there at that portion of time. When you expand to 24 hours, the price balloons out. But they also have a 3 to 5% increase that happens every year automatically. Going back to the point about the ER visits at nighttime, the ER visits at nighttime are billed to the sheriff's department at full cost. So if you don't have somebody in that hour, the bill from the ER may be $3,000 to $5,000 per inmate that is seen through the ER. The ER bills are not cheap. So we all realize that. But those bills are being sent back to the sheriff's department to be paid. So, at some point that becomes a wash if you don't have somebody there after hours.
And that's another thing we need to keep in mind, the rising costs when we do make a decision on the amount that we're gonna help you guys with as well. I know my medication has went up tremendously. And we keep that in mind when we make our decision.
I would actually, the approach that Ms. Moore was approaching, getting the inmates tapped into the 403B pharmacy is a very good idea, because this company provides medication at the full cost to the sheriff's department. So a lot of the insulins are running hundreds of dollars. There's a lot of savings that can be had if the patients were able to use the in-house pharmacy at the pharmacy for the 403B.
But the only way they can do that is it's got to be through
Christus Clinic or the ER.
Yes.
Any
or
contact,
the hospital.
any contact with Christus will allow them to use that pharmacy.
So I have a question. If let's say I go out and break the law and I'm gonna get put in jail for 6 months, I have insurance. Now, I may not have my job when I get back, and say my family is paying my insurance.
Right.
Does that insurance not apply while they're in jail?
It can.
It can, and when they walk in the door, they can sign up. We ask them, we can't make them sign up for indigent health care. And depending on the state of intoxication, how high they are, how combative, sometimes they'll voluntarily sign up, which is a great thing, because that opens up portals of help for them. And then that's up to them. And,
I think a big major problem that we're having is, mental health crisis.
Yes.
We're having a lot of stuff, like we had, a judge had to order a 1622 the other day, basically with, we had, an inmate in there with feces, just having mental breakdowns and stuff like that, and in order to get that person reduced down, there's like a $3,400 shot. It's a quick shot, but it costs $3,400.
that's what we were told.
That's what we were told,
It's the
$3,400 for
truth,
the shot, but there's also, pills and stuff like that that's reduced. It's a whole lot less than that, but it takes a little while to get in their system. Now, we got the pills for the individual, and now it's just, you can walk by there, everything's good, back, not in a complete good mental state, but, it's a whole lot better. But I think at this particular point, I think we probably got 10 or 11 that have some mental issues, and we're having to fight that because we're having to get spinal top. There's not enough beds for those individuals. They wait in our jail we turn out to be a mental institution to hold them until they can find a bed somewhere else, over in, over the woodlands and things of that nature.
Well,
So
who orders the
let me ask you
$3,400
something.
shot? Is there a
Why did it
psychiatrist?
take so long for them to come and evaluate them?
Well, we have Spindle Top, and we have a mental health deputy there. They can come evaluate, but finding the beds, because there's no beds out there. Finding the beds to be able to send them to, there's a waiting list. There's a long waiting list. Matter of fact, I think we just got one out today that's been there over a year and a half, almost a year and a half, and it's a mental patient that finally we were able to get them out and get them a bed. It's just,
Jill,
there's not enough facilities that cover that. And the thing that you find is that we house prisoners not only for Jasper County, we do it for Jasper PD, we do it for Buna, Evadale, I mean, we do it, Kirbyville. We house those individuals, and a lot of times, that is, I hate to say it, is if you're not trained well as an officer, sometimes you use the jail facility as a mental health facility. So if, let's say you've got a guy walking down here and you told him to get away and you know he's got mental issues, what they do is just to get him away, they just file him for criminal trespass, here they go, they take them to jail. So, and we've got this mental patient, and I tell you, whenever a mental patient comes into the jail, he deteriorates or she deteriorates just like that from being locked up in the jail.
worst place.
So what we've tried to do is we're trying to help out and trying to, I guess, train officers to know that. But as an officer, and I can tell back to 30 years of the Texas Department of Public Safety where I worked, is it was just easier just to pick them up, take them, put them in jail. You don't have to deal with them now, they're in jail, Jasper County's problem, or wherever you're at. But now we're trying to train those, trying to train those individuals and stuff like that of how we need to help those individuals, how they deteriorate in the facility and all that good stuff. And I hate to say this, but you know, sometimes we have to just say we can't accept them. You have to take them over to the hospital to be able to EDO them at the hospital, because we can't accept them because they're a danger to themselves in our facility.
And that's so important, detecting whether it's drugs or the mental state. And I do know for a fact that HIV pill is $2,000 that you all are having to give some of them over there. That's a lot of money.
It's very expensive on a day-to-day basis. Matter of fact, I think we had a mental patient, I think that we took over to Christus, was there, that shipped them off to Beaumont, and I think there was three places. We had the ride over there. We got billed for $600,000 for one, and for $200 and something thousand for the next bill. So when we looked at the bill, it was almost $1 million by the time just in that one person. And, you know, for us, $1 million, I mean, that's, but we're just trying to figure out what we need to do and how we can do it, and, you know, try to figure out what kind of programs that we have that can help us out to try to help us through that.
Well, it's been proven fact, just like what you just said, that one inmate can break that jail
Yes, ma'am.
financially. And the medical budget in there, which is just it doesn't even come close to what you need.
Okay.
So that's why we got started a few years ago in trying to help.
Because if they're in crisis, the last place they need to be is in a jail. They will deteriorate quickly in a jail when they're already in crisis. We get them evaluated pretty quickly, whether it's the on-the-scene deputy or mental health deputy and his coworker, Ashley Pena, who's a counselor with Spindletop. So Mitch Hanley is a Jasper County Sheriff's deputy that is attached to Spindletop. So he's our in with Spindletop. One phone call from us, we got Mitch on the way to do a secondary assessment because he's a mental health deputy. He can go, okay, this one's in crisis. He can do the EDO, walk them up to the ER, and then get the professional medical staff to do their evaluation and then get them in the system. Because the last place they need to be is in the jail.
But to help ease that also, our mental health officer if they come into jail, our mental health officer, along with the spinal top, they actually go out to their residents once they're released or
Yes.
prior to, and talk to them, get to know them, make sure they're on their meds, make sure they're doing everything. So they don't only see them when they come to jail, they do, because sometimes it's the first interaction we have. But they also, if they're known, and, if something comes up, they actually go to their house, they actually visit with them. In some cases, the individuals know them real well, like them, and they really calm down and settle down whenever they see them. And that's why we have our mental, health deputy not in a marked vehicle that looks like a police officer. We try to have them kind of dressed in normal clothes, try to have them dressed to where they don't look like a police officer or something like that, so it kind of gives them some ease, whenever they show up, and they begin to get a relationship with them. So if they do come to jail, they can talk them into taking their medication, they can do all kinds of different things like that. So not only do they help in the jail, but they do help out in the community.
Proactively.
Proactively.
Okay. Is there any more questions for Larry or for Steve? Certainly, we're glad that you guys came, and we will get together and put our minds together and come up with something.
Y'all
And
can,
you will be on the agenda. I do apologize.
no,
I forgot, and Jamie did as well.
if y'all can make us a list of your questions that we maybe need to strengthen or back off on at our sheriff's office regarding this, come tour the jail. And Sheriff Havard and I and our team that we put together, if you wanna come tour the jail, see what we have to work with. And, cause it's y'all, it's the county and the community's investment.
And Larry, would you put a list together of what y'all are gonna need?
Yes, sir, absolutely. I
And we
appreciate
also
all
do
y'all.
appreciate what you've done already for us, our
Absolutely.
AEDs, the things that we need and stuff like that, because we didn't have any of that. It's a very, very positive step going forward for us. And once again, the AEDs are just a great asset to this community, and thank you very much.
You're very welcome.
And while we're on this subject, if you would real quickly, tell them what you and I talked about the other day, you want to stop the bleed kits.
Yeah.
If we could help with that.
Absolutely. I was at the border, in Uvalde a few weeks after the Uvalde, school shooting. And, Mayor Steve Crow and I retired from DPS, and they put us through a tremendous amount of training with DPS. It opened my eyes to a lot of stuff. And now here we are, at the front line to protect these kids in these schools and everybody in this community on any type of active shooter. So everything, the AEDs, the Stop the Bleed kits is getting put to use. And, we've already got an AED set up in the lobby.
Yeah.
Issued to the deputies. I have one in my truck. So appreciated. that
And
you-
not only did it help here, but I was actually, able to be deployed to Kerrville. We carried some of that stuff with us to Kerrville, just in case, there was some survivors down there that we were able to locate, the sheriff and I. And I don't know if y'all know that we sent, Investigator Starkey there also, so we were able to utilize some of that. We didn't use it, but was able to actually carry it with us just in case other, counties were in need.
Thank you all so much. And I think you guys need 2 more, is my understanding, and, Hope need 14, Jamie's ordering some more tomorrow.
Okay,
And I will get those over to you guys, and thank y'all so much
well, we appreciate y'all.
What you all are doing.
Man.
for our county.
You bet,
Thank
thank
you
y'all.
again.
Good.
Thank you.
Thank you.
That wasn't bad, I hope.
I know, you did a good job.
You ain't Chuck, but you'll do.
Did I get it? Oh yeah, tell Chuck I'll pass, tell the sheriff I'll pass.
Thank you, man, again, and I'll see you all soon.
Thank y'all.
Thank y'all so much.
And before we move any further, I'd like to introduce Paula to everyone that has not met her. She's our new administrator. This is Paula. Paula, stand up and let everybody see you and tell you about it.
I'm from Kirbyville. I've had, a lot of experience in the hospital. You didn't know that, but I worked there for 18 years.
Well, awesome.
Yeah, and, I'm just glad to be here.
Glad to have one.
Right.
Thank you.
And hear that. She said she's from Kirbyville.
I've heard of her.
She said she's from Kirbyville. That's my hometown. Moving forward. We'll- Item number 5, approval of the minutes from Jasper Hospital District regular meeting on Tuesday, June the 17th, 2025. Is there a motion? Motion made by Nicole,
Second it.
second by Laura Moore. Is there any discussion? If not, all in favor say aye. Any opposed? Any abstentions? Let the records reflect that it did carry. Item number 6, director's update. The directors have the information, item that they wish to share with us. Feel free to do so at this time. All right. Deborah, you don't have anything?
Well,
Laura?
the only thing is, Shane with Integrity Elevator, was wanting to come and do the annual inspection on the elevator on Milam Street this Friday. Is that okay to let him do that, or do you wanna
It's
hold off?
required by law, it
Okay.
has to be done,
So I can go ahead and tell him to come on, okay.
absolutely.
The only thing I have is, you know, we talked at the last meeting about how the city is doing the Halloween around the square here. And so I've got all the stuff for that kind of donated, and, we just need to go ahead and think about what we would like to hand out to the children. You know, if we wanna just do candy, or Paula, if you wanna get with me on that, you know. It's up to you guys, if you wanna order something, we can.
Would you do that as a district or as the clinics, or 3 separate entities?
It doesn't matter, they're gonna set up these 3 roads here. And they're gonna have like a little festival type thing around the square. So if y'all wanted to come do something, you can, but we thought we would just get I've got some blow up things that we're gonna put out front.
Will that be on the 31st, since it's on
Yes, ma'am.
Friday this year?
On the 31st,
What day of the week is it?
I think it's Friday, isn't it? No,
And would it be you that we contacted, or who do we contact
That's
if we
right.
wanted to be a part?
it's
Probably the chamber.
yeah, it's
I think
actually
through
at the chamber.
Yeah.
I'm trying to think if Beverly's still gonna be there then.
Pardon all my
She
weird
is.
questions.
Is that her last day, isn't it?
I think she's actually, that may be her last day.
I think
It's
it
either
is.
that or the
It
end of
is on a
November.
Friday.
She's
It's on a Friday.
retiring. She's retiring.
So just get with the chamber, but you're more than welcome to set up close to us. At least we have a bathroom. Just saying.
The facility was talking about doing a trunk or treat out in front of the hospital.
And
but-
they normally do,
Yeah,
yeah.
they usually do.
But if there's something the community's doing, then.
Well, don't they normally set up in your parking lot
Yeah.
as
No.
well?
They haven't in years, but, the last couple of years, Christus has done it right there where you drive through, you know.
Uh-huh.
They, passed out candy right
I think
there.
it's gonna be pretty big down here, so if you wanted to do that.
So let's keep the date in mind, and, Laura, you know who's chairing that chamber, you said?
I'm sorry?
Who's chairing that for us? Are you?
Yeah.
Okay. Get with Laura if you need any further information, or you wanna be a part of that. Jamie, you have anything?
And at this point, no.
Item number 7, moving on, report from Jasper Memorial Hospital Administrator.
Alright, so June was another, very good month for Jasper.
Could you tell us who you are?
Of course I will. I'm Sherry Willard, I'm the new president and
Hi,
CNO, at the facility. I started the middle of June, and so I'm still trying to figure out all the people and all the things. I have, my background as a nurse. I've been a nurse 28 years, 29 years. I've been in hospital administration for the last 16 years. I come from Wyoming.
Oh, my goodness.
My husband actually grew up in Toledo Bend, so he hasn't been here in 40 years, but he's not, he's very accustomed and he has lots of friends and,
He's
so,
glad to be home.
I was
isn't he?
gonna say, yes, he is good. I love it. For me, I needed a change. He sold his business, which gave us the opportunity. All my kids are grown, and so here I am. And I'm very excited. I really like the heat, so so. He's melting, but he's gonna be fine. So, that's a little bit about me. For the facility, and I'm gonna give you what I've got, and then I want you guys to tell me if you want additional information or kind of what you're looking for. We had great, June. We don't have our fiscal year-to-date numbers yet, but well over budget, which should turn out well for the hospital district. Our volumes were high in June for the ER. We had about 1,800 patients that we saw in the emergency department. Length of stay was good, on the inpatient unit. I'm still working on getting us some surgeons. So I have a GI physician that I'm talking with, actually I think tonight at 7, and, just working with, trying to get us a general surgeon for our community. The other things that I'm really charged with in terms of volume and how the facility's doing are, what things can I keep locally? So I watch our transfer log, I figure out what we're doing. Everyone I've talked to in the community's like, they just transfer you from our facility. And so for me, that's a huge thing. We need to be able to keep our care local. We need to be able to, it's hard for families to drive when we ship you to Beaumont or Lufkin, and so just really being able to utilize our resources. Obviously, we are not gonna have, neurosurgery in Jasper, but we can keep a lot of things, especially utilizing telehealth services. So that's kind of my charge there in terms of our volumes. Our patient experience, our HCAPs are doing great. The one area that we're working on the most is discharge information. When you get ready to go home, you have a whole lot of information that we just spew out to you. So trying to come up with a few ways to make sure people understand. So I've instituted discharge phone calls to the patient the next day. By then, they've figured out that they didn't understand the meds, or they can't remember, what happened. So we've instituted a phone call to them just to say, hey, did you get your medicine? Do you have what you need? Giving them a resource in the event that they didn't know. So those are some of the things we're working on there. Our ER percentage, we're doing fairly well. Obviously, sometimes the wait times can get a little, in my opinion, out of hand. So working on some throughput and, how do we take care of especially easier patients? How do we get them in and out so you're not hanging out there waiting when your issue is small, and yes, you're behind a trauma or whatever, but we still need to be able to get you in and out. So working on those. As far as I sent the board the charging station. Hopefully that was kind of what you guys were thinking. It's utilized every single day.
Good, thank you.
By our patients and their families. And so we're actually looking at potentially another one on the other side of the ER over by the tablets.
Thank you so much for that.
You're very welcome. That was an easy one. I was able to pull that off really quickly. So if you could give me easy jobs all the time, that.
All right. I'll think of something else.
There you go. So working on the keypad for the helipad access. I think they were working on that, or maybe it's coming up. So we're working on that. We did meet, they will notify the security so that they can let them in that door and until that gets fixed. So we had a conversation with them yesterday about that.
Okay.
So
Thank you.
they can utilize that area and just call security. And I think Misty gave them the direct line to security.
So what she's talking about is when, Air Rescue's notified of a pending flight and they're coming from Christus, they're going to contact the ER and ask the security guard to go to that door and give them access into it so they can use the new sidewalk.
And then hopefully our keypad gets put in soon, but until then, we're able to utilize it.
Good.
Tomorrow, we're doing a big town hall, so we try to do, I'm a huge proponent of town halls, so I try to do them at least quarterly, where we present, things going on to all of our associates. So for, the facility, tomorrow that happens, so you may hear from that from associates. Really, we're talking about, the strategic plan for Christus as a whole, and that's really reach and being able to take care of our communities that we're in, and be able to continue to provide those services. There's a lot, going on Christus-wise, in terms of, providers and trying to figure out that piece. My background, we employed all of our docs, so this has been a new, change for me and kind of understanding and learning, how that, works with Christus. But they too are also in a change, with some of their providers. So, the other things that we will be talking about, were our stroke awards. So we just received yesterday from the American Heart Association, the 2025 Silver and Silver Plus for stroke for Jasper Memorial. So, again, that's about getting those head CTs done quickly, making sure that if there is a stroke and there's not a head bleed, that we're able to give those thrombolytics to get that clot buster doing its job so that there's not lasting effects from a stroke. So our facility does a great job in those metrics and taking care of our community in that aspect. We were surveyed recently by the DNV. So historically, Joint Commission was the accrediting agency for the facility. Christus as a whole switched to DNV this year. So it'll be a process kind of transferring from Joint Commission to them, but they came and did their survey. We had no, what would you call those? Well, we had a few I would love to tell you we had none, but I would be lying to you straight up. We had no immediate harm issues. We had 3 that were non-condition level, and then we had 4 that were opportunities for improvement. So overall, they were there for about 3.5 days, and to have 7. So that happened on my week 2 for me. So
Nice.
I just
What does
learned
DNV
right along with the
stand for?
surveyors. I was just walking around with them. So
What do those letters stand for and who are they? I mean. for
What
you
does the
information.
DFB stand for?
What do those letters stand for and who are they?
We know they are accrediting agencies.
they are an accrediting agency, and I could not tell you.
Well,
I'm gonna,
Google will tell you.
I'm gonna Google it.
No,
Can I
no, you
Google
go
it?
ahead, we'll find out.
I've always just referred to them as the DNV, so,
Aren't they
not
gonna
to be
come every
mistaken with
year?
Department of Motor Vehicles.
Aren't they going to come every year instead of every 3rd or 4th year?
They do. So their whole thing is that they come annually and they do little bits and pieces, but still, every 3 years, they still have to do a massive survey because that's what CMS requires in order to have a deemed agency. So, but instead of never coming to see you except for that every 3 years, they come annually and do parts and pieces of it, as an assistance, I think, to the staff and the facility.
well, that would be helpful.
This is what DNV stands for, Det Norsk Vertitus.
Oh, that's a,
Yeah, nice, huh?
I have,
Do you wanna
what
write
does
that
it
down?
say?
that's somebody's name.
Well, no, it's accreditation agency for hospitals, healthcare certification and hospital accreditation.
Bet it's somebody's name that is on it,
Somebody's name,
yeah.
would have been better just to make them the DMV and call it a car. But I've never looked it up, so now I know that, I still don't know what it is, but it's somebody's name. The other thing in the quality, aspect for the facility, we do great with our hospital-acquired infections, we have none of those. Sepsis, they went live with Epic in March, and so trying to work on how that whole system works. I will say the reporting aspects of Epic have been, amazing. I did not have Epic where I came from. And so being able to readily pull reports to find out what are we doing well, what's an opportunity for us, Epic will be huge. But in the process of a new system, you're always trying to figure that out. So working on sepsis, again, you know, that's more those repeat troponins and things, and just really to make sure that we take care of our patients to the best of our abilities. What else would you guys like to hear from the hospital on a monthly basis, all the time?
I have a question. You said that you're kind of beginning to look for a surgeon. Do you know yet, like, what type of surgeries you're kind of wanting to, or what they're gonna do in Jasper?
I would love to have a general surgeon. I have reached out to a couple of the rural residency programs. A good friend of mine went to that, and they actually, in their residency, they are taught to be the only one. And so they do some of everything. They do all of the scopes, they do the GI procedure, you know, EGDs, colos, but they also do appendectomies, colis, you know, just some of that generalized
What
surgical.
about ortho? Would they do, or would that more be an ortho?
Yeah, that would have
specialty?
to be an ortho.
Okay.
And right now, just trying to work on, you know, can I get, I actually have a couple meetings set up trying to get an orthopedic, Beaumont just got a new orthopedic group. And so I'm trying to get them where they will come twice a month and see patients here in Jasper. Some of those things, we might not have the volume to be able to support a full-time provider of, you know, especially those specialties where they have to have so many population in order to, trying to think of the word that they use for that. But basically, it's all based on patient population and, you know, how many you have to have.
We definitely need a general surgeon. All the patients that we have are being sent out.
Yes,
So,
general surgery is like top on my list. I don't, that has to happen for us. The GI physician, that I'm talking to, that's great. And they do, you know, EGDs and colos, but I really want a surgeon
yeah.
that can do that and
Yeah.
all the other cases.
Right.
So I'm a huge proponent of general surgery.
Right, I mean, we send out our acute appendectomies and our patients that come in with ascites and patients that come in with lumps and bumps and complex wounds. So we really need a general surgeon.
Yes.
Really, and we need one in-house and we need one here to take care of the community. Otherwise, they're all being sent out.
Right.
We've
Every
had
one of
general
them.
surgeons before, we've had 2 general surgeons before, and we've had orthopedic surgery before,
Mhm.
so the population
Right.
supported it.
Right. Yeah, it's just a matter of locating them. And I did a training with Christus, day before yesterday, Friday. Just on how their system works, because that's all I really need to know is what levers do I need to pull? What's the process for getting these providers here? Once I can learn their process, then I'm gonna implement my own strategies in physician recruitment and, getting providers.
Well, they have a recruiting group, don't they? They recruit doctors.
They do.
Not for
It's
Jasper.
it's morphed, and now it's called CTC, and so, it's expanding, I think, throughout Christus, but it started over Dallas, Tyler area, so getting that flow to get all the way over here to southeast Texas is what I'm.
I would like to know how often the pharmaceutical plan is being used, the 403B.
I wrote that down.
340B.
I know, I saw a report recently, and it didn't look like it was utilized as good as we could be utilizing it, which is why I made a note, you know, if we can, help utilize that for the jail, that will, one, make sure that we have the right volumes going through that to keep
Exactly.
the plan.
Yeah.
And be able to help, so I've made a note of that. I honestly don't remember, I just know it looked low to me, as far as the utilization.
Wasn't that something that the board done, Deborah? We got
Yes,
that.
the board got that and redid the, pharmacy and all that. Now, the 340B is generated and it's Medicaid.
Mhm.
It's how many Medicaid patients are seen as inpatients in that hospital. That's what can make or break the program, because if they don't meet the quotas yearly, they can take it away.
Right.
So it's based on inpatient Medicaid patients. How many do you see a year? Or I guess they look at it yearly, I don't know, they may look at it monthly.
All the OB patients are Medicaid.
Huh?
They sure are, a big majority of them, that's for sure, if we had OB.
I'm teasing, I'm
Oh,
teasing.
you know, I
If we
really
had
can
OB.
feel for everyone. I know that was a huge hit to the community. I had to do
Still
that
is.
where I'm from, as the CEO there in relation to volume, and so I can understand it, and I've lived through it, and I'm, you know, it still stings. Speaking of that, OB, I didn't talk about that. So we've got a discussion going with the Temple Foundation in regards to a midwife program, bringing midwives to our community. And then I also am looking at where I was at. Because I closed my OB program, we utilized nursing and did a lot of telehealth with an OB provider. So they still are being evaluated. Obviously, if you have to have checks done, anything like that, you have to travel. But if it's your regular monthly checkup and you're just measuring and doing all of that, then we can have somebody do that. And then you just do a telehealth with your provider, which cuts down on the amount of times that you're having to travel out of town and the cost to the patients for that. So I'm working on a few different things like that to see if we can't implement some of those for our community, for those pregnant moms.
Can I ask you a hard question, sir?
Yes.
You know, one of the, as departments close down, it's almost impossible to open them up again. I sense that the urgency for a general surgeon to be very high, only because you have a department, otherwise known as surgery, that's not being utilized. So what are the realistic outlooks for that department? Is it in that closure? What are you doing, and how much delay would you gonna give it before you go, not enough volume, close it down, we're gonna lose our surgical department also?
I am not ever going to be a promoter of that under any circumstances, nor do I feel like Christus is, in any of my conversations that I've had with him. Right now, we do pain procedures back there, so we do have volume running through our OR as far as staff and, you know, just how the department operates on a day-to-day basis. We also, trying to work on urology. I think there's quite a few urology cases that we can do if somebody just came, you know, once a month or twice a month. So I think that there's a lot of opportunity for the OR outside of a general surgeon, because that I think needs to happen. But there's also opportunities for other things, where we're able to do those procedures here in our facility.
Because it's very usual that once OB closes, that the OR closes soon after.
Yeah.
So
I can tell you that that's not my intent, nor is that my background. I just really dug my heels in and said, okay, what all can I do? And I wanna do the same thing for Jasper. Because there are a lot of different specialties that you can get to come in and do procedures a couple times a month, whether that be ortho. Maybe we wouldn't have a big enough program to do total joints, but you can do smaller ortho cases, scopes, urology, ENT is another one that, you know, is one that you can really utilize. So that's my take on surgical volume and Jasper
Pinky
and
promise?
what needs to happen.
pinky promise?
Yeah, pinky promise.
Okay.
I can promise you I'm not bringing OB back, but I am 100% about, promoting growth and doing what we can do to keep our patients here.
You promise you're not bringing OB back?
What?
You promise you're not bringing
Well,
OB
I
back?
promise that that's not on the agenda. As unfortunate as that is, I don't wanna give anybody a false sense of what that might look like. But I am committed to, how do I do what I can for that patient population. And right now, I'm not sure what that looks like, if it's midwives, if it's, I think midwives, the potential issue with midwives is they like to deliver. That's what they go to school for, that's what they train for, and so to put them in a situation where they can't deliver, I think could be a little bit of a challenge in getting someone hired. I haven't tried that, so I'm not gonna say that I can't make it happen, but that's my concern. So for me, I'm looking at, okay, what can I do? How do I utilize all the resources we have here to take care of that patient? But I don't wanna ever mislead you in thinking that I'm gonna show up here and fix all the OB things, cause I'm not gonna be able to pull that off. Does that make sense?
Sure.
Okay.
I have a few things I want.
Oh, you wrote a list, yeah.
If we could find out, like, the number of patients transferred per month, the
Yep.
number of inpatients, hospitalized a month, even how many psych, we'll just pray with you on those. But
Yes.
how many psych patients you see, how many traumas, cardiac or stroke. We do have, doctors that sometimes come and talk to us.
Mhm.
So this way we could kinda let them know, hey, this is what our hospital here in Jasper is able to take care of. This is the number of patients that they're generating through that facility in a month's time, and kind of what category. That might even help maybe some cardiac, or maybe help neuro say, hey, we'll get more involved with you or something.
Right. Yes, 100% I can do that, especially, I would tell you, Epic is really great about, it can spit that stuff out for you pretty quickly, so,
We wouldn't know, would we, Dr. Fran?
Not yet. Those spit things out, but they're not very useful.
we had, I can't remember what we had, exactly where it was at, but it was.
There's a story there.
You can't have a story and not tell me.
We'll tell you later. You and I need to drink first.
We have a very contentious, love-hate relationship with the EMR.
Yes, I can really get that. Yeah. What do you use?
Well, it's not working. Rock,
Paper,
paper,
pen.
paper,
Right there, we
pen.
use our hands.
Right?
Crayons and paper.
I started out with the paper and pen, I'm all about that,
That's right. Good old fashioned,
right?
try and true.
Any other things from the board?
Thank you.
Thank you very much. And I do apologize. I just took for granted everyone had met Jerry. At this time, Melissa, item number 8, primary care physician.
Okay, well, we've been busy. We are still working with Athena, and we have a new guy that we're working with at Athena. That, has been pretty interesting. So, anyway, we're working on that. We're having 2 meetings a week now, trying to get that up and going. With Practice First, they're joining us, and they're trying to help us with the transition, so they've been a big help, so. We've been working on the rural health survey. Deborah and Paula, Edie, Rosa, and Nicole, we've been working with the compliance team with them too. I think they're awesome. We've just got started with them. I think they're gonna be great. They're a big help already, so. Working on policy and procedure still. There's a lot of things we still need, like for the, rural health survey. That's gonna be a lot, but I think we can get it. And I think it's gonna help us learning on the way, like things that we are not real sure of. It's just gonna be a learning process, and I think it's gonna help a lot, so. Me and Edie tried to get on a webinar today with the compliance team. There were some problems, but I've talked to them today, so hopefully tomorrow, they'll be better. It's from 11 to 2, and it's with Esther and some of the ones that you met, Deborah, and that lady.
Is there a deadline yet, a timeline for the, survey, for the rural health?
It has to be done by the end of December.
Okay, so the survey has to be done by the end of December for us.
Right, yes.
Okay.
So, December 21st. And then, our AED, we have it now, we do have one, but we just need to get it put up on the wall, like whoever can put that up. I just don't wanna be the one putting holes in the wall and all that, so I'd rather somebody else be the one with that,
Who would
so.
we get to do that?
Is that a little kit for that?
Put the
It's
AED
super
in
easy
the
to
wall.
do. There little kids putting that on the wall.
You gotta volunteer.
Yeah, I see that, yeah, that'd be good.
These girls, I don't think they put it up
So,
yet.
Miss Jackie, right?
Order some
Jamie said he'd
supplies
do it.
for the survey and stuff, we're still having to get a bunch of that stuff, so you're gonna see a little more spending, because we're having to get supplies and different things that they're requesting that we have, so there's still some things that, we're having to order for that. Just the job descriptions, all that kind of things, getting things in file, there's a whole list of things that we're having to work on, so we kinda got some teams together and kinda working on that, and hopefully it all come together. We've had 208 patients, and that was being out with 3 days, I feel like that would've been, that was a good thing, so still more, 35 referrals. I'm really not sure on the no-shows, I had that last time, but I didn't have it. And then, Dr. Pham, was there some stuff that you wanted to?
Yeah, well, first, I wanna thank the board for allowing us the time to support Terry in her time of need with the tragedy that took place. So, thank you all for the opportunity to be there for Terry. So that meant a lot to all of us that want to be there for Terry, so thank you. The team I have now is excellent. I will tell you, I am very pleased with every one of them. Lisa up front is doing a bang-up job of calling patients and filling in gaps. We're scheduling 20 patients a day, and of course, there are no-shows that are taking place, and she tries to fill them up pretty quick. My 2 nurses, Kathy is doing fine. Brittany is a good representative of your program. I'm very proud of her. So kudos to the program that produced her. She is motivated, and I like her very much. So the team that I have now is excellent. Melissa, including taking charge of us. But we are seeing a lot of patients, a lot of new patients. And I'll tell you, since we opened up, we have probably been instrumental in probably saving about 15 lives directly. 15 patients that would have died since we that would have not survived without us being there. That includes heart attacks, that include acute appendicitis, that include major outbreaks of heart failure and pulmonary emboli, people that we made that big of a difference in. And it's not counting all the complexities that we deal with on a daily basis. So we're not dealing with colds and coughs, we're dealing with major health complicated patients that are coming in that haven't seen a doctor in 10, 15 years. Their A1C levels are 16, they're losing weight, they've got cancer. We dealt with so many cases of cancer, pancreatic cancer, penile cancer, all manner of cancer patients coming out of the woodwork that have not seen doctors in a very long time. So I want you all to know that financially, I know we understand we have issues, but the impact that we have made in this community is priceless. Those people that survived, whom we have helped, it's not about the money. For them, it's about having the ability to survive another day and be with their families. So I am very pleased to have a team that has given us that opportunity. But we're making headways every day to increase our volume. And the days that we see 20 patients, it's hectic, it's very crazy, only because we're paper and chart. Everything we do has to be done manually. So when we get Athena going, and that's what we're working on, it's gonna be much, much better, so.
That's not
How
what you're.
close are you all to getting Athena going?
Is there a deadline, is there a date for that, that you all have targeted?
Well, in the meeting we had this morning, it was a testing meeting for the interface part. So they were making sure that information that we put into Athena will travel over to the open PM system for our billers and coders. So the new guy we're working with, he's very hard to understand. It's an hour-long meeting with someone who's hard to understand, but then also IT talk that is another language. But from what they said this morning, all of the testing went okay, so they were going to do one more test and then send it to production. So that sounded, the rep from OpenPM said that sounded positive, that's the next step where we need to be to the go live date. I wanna say they told us last week they were shooting for 5 more weeks, but
We could go sooner.
but it could go
If they can-
sooner, especially since we're newer, you know, we don't have 10,000 patients in the system. You know, we're at, I think, 1,400 between the both of us. So that should make it go a little quicker as
There-
far as demographics being converted and
There are
such.
multiple components. There's the building component, there's the specialty component, there's the lab component, there's the x-ray component, there's the EMR component, there's the pharmacy component. So there are multiple modules, components that are testing individually. But, so you're thinking about 5 weeks?
Yes, or
That's what we're hoping.
Okay.
Athena really is a good program.
It looks very user-friendly.
Mhm.
I just once, I wasn't aware of all of the background building that goes into, you know, what we need. And it's been an eye-opener, but man, we're almost
You'll be
there.
happy with Athena.
We're almost there.
Where I came from, all of our clinics,
We've heard a lot.
30
of
doctors,
things.
we're all
Everybody
on
tells us
Athena.
fine.
We're on it, okay.
it is very
Yeah.
good.
Rosa, I can attest to what you're saying, talking to people you don't understand. I was talking to a guy, and it was phone was translating in English what I was saying. And he would talk in his language, and my phone, I said, look, just forget the deal.
It's frustrating,
Very.
but I mean, it's part of it, so it's what we get to do in 2 1-hour meetings on Tuesdays and Fridays,
But the
so.
person is
Okay.
speaking English.
He's speaking English,
So
but
translating
I
that.
mean, it may be, we're gonna say it's English. We're gonna
Is it
stay
Indian?
positive.
Is it Indian?
I'm gonna say Indian, but then again, man, I really don't know.
Could you
It's-
invite me to this Friday meeting?
Absolutely.
I have a long history of interpreting.
Oh,
I worked in
you're-
Austin in the technology industry, and most of my coworkers had a strong accent.
Okay, yeah, I will
What-
send you
what
that
time
invite
would the
first thing in the
meeting be?
morning.
11 to 2?
No.
Friday?
Oh, no,
Friday.
these are from 8 to 9 in the mornings.
Friday, I'm off, so I can.
And if Jamie could get on there too, that'd
No.
be good.
I don't speak that, and you won't.
Should Paula be on?
Absolutely.
Yes, yes.
Paula needs to
All
be
of
on.
you on there as well.
Lucky you.
Sure.
If you know what they're trying to say, it's very helpful. If you're familiar with the jargon, like you.
Melissa, do you have anything else?
No, sir.
Okay, what about you, Doc?
No, I'm good, thank you. Thank you very much.
Thank you for a very good report. Rosa, before you come, let me ask the question, has anyone reached out to Terry? I tried to call her and I have the wrong number. I have a new phone and I'm just concerned about her.
Yes, we actually, Terry being Terry, she came into the office for a little bit yesterday, and she did catch up on, checking some lab reports that came in while she's been out, imaging reports, prescription refills. She was having an okay day yesterday. I say okay, but I mean, Terry is by far, she's got to be one of the strongest people I know. Like, I can't even imagine. But she had a smile on her face yesterday. She seemed in an okay mood. I've messaged her today. I'm just gonna go out on a limb and say I don't think today has been a good day. But that's just me speaking
But let
on
me
her
say this,
behalf.
that's what you see on the outside. Having lost a son myself, she's torn up like I am on the inside.
Yes,
We have to smile to get through the day. But
I-
when we're alone, y'all stay close to her.
I will say, I mean, I know everybody has her in in our prayers, but I mean, I can't even put a time limit on it, but once everybody else goes back to their normal life and goes to work and does their things, and she's getting a little bit of the quiet time, keep her in your prayers then, because that's, I worry about her for when it does settle down, and she's gonna need everybody.
You wanna stay close to her. I
Oh,
made many
we-
mistakes thinking about my son's death, not paying attention to what I was doing. I even turned down one-way streets, you know, I mean, it happens. What you see on the outside is not what's on the inside.
What's on the inside.
Now, can we get your report?
Yes, yes. With that being said, I ran our report from the last board meeting to today. Oh, yeah, well, I mean, I was gonna get to Chris, but everybody, Chris joined our team this past Monday, due to the situation. And I know he's probably tired of us saying, like, we appreciate you for coming on early. We will never be able to thank him enough for coming on early like he did, and 100% him and his nurse Jennifer jumping in to something that they weren't prepared for. Like, I know he's prepared job-wise as what he does seeing patients, but coming into the office, 100% paper charts, and realizing what all we have to do with paper charts. It was an eye-opener for them.
It's been a long time since I wrote paper.
So, you know, having him, yeah, he's been a lifesaver. And when I say they jumped in full force, yesterday was his first day, and he saw 11 patients, which, I mean, again, for paper charts and on your first day, that's a really good day. All the patients were happy to see him. We already have a good number of his patients calling, saying, oh, we know Chris is there now, we need to schedule with him. So it's, yeah, he's ready to rock and roll.
It's a good thing.
Yeah, it's been good. His nurse Jennifer, yesterday was an eye opener for her as well, but she came in today and they're starting to get their system down, and I think it's gonna work out well. They both came in today, so I feel positive that we're doing something okay, yeah. Do you have anything you wanna say? No, you're good? Terry did obviously see less patients for the reporting period, but, you know, she's obviously been out. So, in the time that she was there, she did see, our BioT hormone pellets that she does. She did see 8 patients within 2 weeks. So that's pretty good, you know, that's almost a pellet patient a day. Chris and Jennifer are both, on August 1st and 2nd, we're getting them signed up so Chris can get his BioT certification. So that way he can start seeing pellet patients, and we'll be able to book more patients, have that's cash flow, that's all cash pay. So that will open up the door where we can get in some more cash pay patients. So I guess I was gonna give Jamie the heads up, be looking for that charge to come through, like I'll have to pay for their pellet certification. So that will be coming through.
I'm more worried about the after-hours charges, but I don't know.
That's all coming out of his own pay. No, but, Chris is also gonna look into doing the DOT physicals. We're gonna get him certified to do that. So Terry does quite a few of those, so having another one to come in and do it, again, 100% cash flow. So,
Speaking of DOT, if I could just briefly interrupt you, Dr. Pham, I had somebody ask me the other day, if there's any way possible you could consider doing FAA physicals.
Yes, we do.
Pilot physicals.
We do.
You do pilot physicals?
They're not that simple, they're not that complicated anymore. They used to be much more
So
complicated.
there's FAA has a registry.
Yes, there has to,
Physicians that do that, you're not on there.
it used to be much more complicated. I think that now I'll look into that for you. But
Please.
yes, I'll look into that.
I've never had that question before,
Okay.
but I had that the other day.
We'll look into that.
Okay. Sorry.
well, no, I think that brought up a good point. We had someone that called us for the FAA physical, but it has to be an MD that does those.
That's correct.
So it's not anything, we'll be able to do out there, but if we have anyone that calls, we will 100% send them y'all's way. So if y'all
Let me
do it,
ask
yeah.
a question, Lena would ask Jamie, I've had people ask me about this weight loss shot. Do y'all do that?
We do.
Okay, I told them I didn't know, but
We do.
I'll find out. I
We do.
probably need to get one. myself.
We actually have it very economical. We actually make it very economical for patients. We get them hooked up with the pharmacy directly, and it's actually even more economical than anybody else around here.
It really is, yeah.
Okay, well,
There-
I will refer them to you guys.
There used to be, SNR in Kirbyville, they do compounding, and they still do the semaglutide compounds, and we can send there, but there is another prescription that they don't do anymore, so we do have to send to like Lilly Direct, but we've had good success with it.
Thank you. And Dr. Sam, I must say this, a lady came to see you, she said she thought something was wrong. The care that you all gave her, said everybody came in, spent time with her, answered all her questions. She said she left there feeling better having to visit with you all. And thank you all so much for the care that y'all have provided.
I think the two clinics that you all have established, I think will speak well of the district going forward. I really do. I think that the efforts that have been put out, the trust and the belief and the risk that you all took, it's gonna pay off. There is just no way that the community is not better served by the two clinics that you all have established. So, really honestly, sounds very much in your book.
Oh, no, I just had, I guess it's really kind of a question, and it's regarding Chris. And with Melissa doing the rural health, compliance and getting all of that set up. I know at some point, we gotta share Chris, but do we have a date for when Chris needs to start being in Dr. Pham's office? Or are we basing this off of when we know Terry's coming back?
It doesn't
Just
have to
so
be,
we
yeah.
know.
As long as it's on paper that I have a mid-level half the time in the clinic, and that could be once a week, and so as long as there's a mid-level designated, that's all we need. The actual date and the actual time presentation doesn't really matter. There's flexibility in that. So when Terry comes back, then, if Chris wants to stay there, I just may need, if there's not another mid-level that is down here, I may need to borrow Chris for, 2 half days out of the week or whatever.
It just depends on the volume.
It depends on the volume too, right? So it's nothing carved, it's nothing set in stone, other than the fact that we commit a mid-level to this clinic half the time, or at least half time.
Yeah,
Okay.
50% of the time it
That's
has to
right.
be every
Okay.
level.
So it could be, once a month for 2-3 days, or it could be distributed however you want to distribute that.
Okay, yeah, I know with him being there and us having to book out his patients, that we're seeing, if he says, hey, they need to come back in 1 month or 2 months, us booking out, I just wanna make sure we're not gonna have to call and reschedule or, make it as easy as
Right.
possible.
I mean, really the answer is gonna be, as hard as it is to pin down Terry's time, the sooner Terry is able to give you some clarity, then that will make it easier for you, really and honestly.
Right, okay.
So,
And she's gonna face some tough times when she comes back.
yeah, and so she
Yeah.
will be adjustment.
Be a while.
Rosa, how many patients did you see for the month?
For the month total, let's see, Terry was at 124, and Chris in these 2 days has seen 19, so 143.
Total patients or new patients?
That's total patients.
Is that from
That,
June first to when?
that's actually from June 17th. I do my report from board meeting to board meeting. So it's from June 17th to yesterday, July 14th. Which, again, like I said, well, we were closed for 4th of July, but then last week, Terry was out all week, and then this week, so that's usually about 60 to 70 patients.
Do you have our new patients?
We have the new patients.
One thing we talked about was you all being open during the summer months on the weekend.
Oh my gosh, why?
Accidents on the lake,
I will tell
it
you,
wouldn't be feasible.
Friday afternoons, nobody comes in.
Yeah, Fridays are.
Everybody's scattered on the lake and out of town. There's just nobody who comes in on Friday afternoons.
Over
Yeah.
half of ours didn't show up last
Yeah,
Friday.
the no-show rate is like 50% on Friday afternoons.
And that's with confirming the day before, because they're coming, nobody showed. And the phones don't ring, it's terrible.
Yeah, well, I mean, we may have our patients show up, but as far as people that are calling, saying, hey, something happened, I need to get in today, or people walking in on Fridays, the phone hardly even rings.
They're waiting for Monday.
Football season.
We're
Especially
going to the
schools
lake
start
this
back.
weekend, we'll call you Monday, yeah.
Thank you very much, Rose. Is there anything else?
No, sir, I think that was it.
Jamie told me that, Chris, that you had hired a sports doctor. Said you got writer's cramp or something.
No, he's probably workers' comp.
Workers' comp claim.
Yeah.
For Miss Deborah, we're seeing tons of new
We
patients.
didn't sign no
4 days,
He trusts
every
us.
day.
You got the
He
contract.
trusts us.
You can
That's
make
right.
a bunch of-
Have either
Thank
of
you.
either of the clinics, thought about doing the,
Oh,
the physicals, the sports physicals for the kids, advertising for that? Or vaccinations for back to school, or any of those types of things? Have y'all thought about doing any
We
of
don't
that?
have our vaccines, and they're very expensive, I mean, they're like,
we're
really,
not doing any vaccines at
Yeah,
all.
no
we
vaccines.
don't have any.
No vaccines.
Cause we're still not contracted with Medicaid.
Okay.
So, the sport physicals, it was in May, I believe, Terry took half a day and went to the high school and actually knocked out everybody that was due for a physical. She knocked out there at the school,
At Brooklyn?
at Jasper.
Can we
And we
try to,
could do that.
huh?
And we could do that too, like if we set a day and just have them all at one time, we could, even if it was a Saturday, we could we could work something
Any
out.
day that you'll want, just
Yeah,
get the kids
We'll
lined
do
up.
it. Yeah, we'll be glad to do it.
If there has been a request from the school, please, let us know.
In Brooklyn, we can do as well because it's in the district, so.
Yeah.
We'll be glad to.
Okay,
Yeah, absolutely.
I'll get with mom
Do what?
at the school. I know they have
Oh, maybe
somebody
do it
they
there.
use
Okay.
already, but I'll see, if we can get our foot in
Yeah,
the
we're
door.
the local school.
Who are they using?
Definitely appreciate the help.
I don't
what?
remember,
Appreciate the help.
I can ask her, I'll get their information,
Yeah.
but that's what they go to the school, and as long as the student gets the physical done at the school,
They pay for it.
the school pays for it, so it's free to the student.
Yeah.
So they usually have a pretty good turnout to do that.
It's just that time of year we need to be thinking about it.
Yeah, I think they do like 20.
Is there anything else from either one of our clinics? Item number 10, to discuss the possible action personnel matters, including recommendation of hiring of staff, related to the primary care, vision, or total care.
So Nicole says we need to hire these people that we've been talking about all night. We ain't officially hired Chris or Jennifer yet.
That's not what Facebook said.
Yeah.
I know you're looking for mercy.
Trial, baby, trial.
You know where you can take it. So, do you wanna talk about Jennifer?
Yeah.
Just, we need to approve hiring her, I
Oh,
guess,
yes,
since she's already went to work for us.
yes, so we do need to approve Jennifer, she's coming over. Chris has worked with her, I don't know Jennifer personally, but many do. And I think we put her at, 25 an hour.
What is her last name?
Right,
And it's spelled, her first name's spelled
it's Jennifer with an A.
Jennafel. Is that the motion?
I make a motion that we hire Jennifer Wright.
There has been, I'm sorry. There's been a motion made by Jennifer, excuse me. To hire Jennifer at a rate of 25
How much?
an hour, $25 an hour. Jennifer Wright. Is there a second?
Second.
Second by Deborah Harris. Any discussion? All in favor, say aye. Aye. All opposed? Any abstention? Let the record reflect that it did pass to hire Jennifer Wright at $25 an hour. Let the records also reflect that Laura Moore has left the meeting.
Where'd you go?
She's backing out now.
She has to leave.
Said she had to go.
Item number 11 to discuss.
Oh, she didn't wanna vote on Chris.
I
That's what
thought,
it was.
I thought we were gonna skip.
Look at him looking around like I quit.
I would like to entertain a motion that we hire Chris. Is there a motion?
We hire Chris.
Jamie, cut it out. Motion has been made by Nicole that we hire Chris as our second. Mrs. Templeton second. Any questions? All in favor say aye. Aye. All opposed? Any abstentions? Let the records reflect, Chris, that you are hired just as soon as we sign, put the ink to it.
That's it, that's the contract.
And, item number 12 to discuss, oh, that was it.
No, it's 12, it's policy and procedures. Are we?
Yes, number 12. This is something that we tabled in our last month meeting.
Didn't y'all say y'all were still working on that?
Yes.
Okay. So just-
What we'll do, we'll just table it again. Jamie, your report.
Flip back to the one that says Southside Bank on the front. The top two sheets reflect current bank balances for each account. You'll notice on the public funds platinum account, that's where the CD money went to. That's why you see the balance that you see in front of you. We're gonna go into executive session in a little bit. We're gonna need to talk about some monetary things with some real estate offerings. And, in that, I'll explain this a little bit better, but for now, that's what you got. And if you'll flip back, you'll just see the current bank statements for the previous month. It's due, no, it's not
Next
due
month.
till November. Yeah. Yeah, it's November. October, November, one of them's clinics, one of them's hospital. It's every 6 months.
I think they told me October.
Yeah, October for one and November for the other.
Okay, thank you.
That's what I heard.
That's all I have, right?
Okay, all right. Is there a motion to accept the secretary's report?
I make a motion
Given
to
by-
accept the secretary's report.
Motion made by Demetrios Hadnot, is there a second?
Second.
Second by Mrs. Templeton, all in favor, any discussion? All in favor, say aye.
Aye.
Any opposed? Any abstention? Let the record reflect, that it did carry. Item number 14 This is an item that we tabled in our last month's meeting, discussed for possible actions, the dissolution of the, Jasper Memorial Hospital Foundation.
So the consensus, the legal minds are that we have to first resolve our nonprofit status before we can dissolve, since we are incorporated as a nonprofit corporation. We all have discussed that process previously. The contractor that we hired to produce the previous 990s that go all the way back to 2007, they have completed them, and they have asked me to verify their accuracy, which I cannot do. So all we can do is go with what we have, and what we have are compilation reports and filed 1120 tax returns. The only thing I have confidence in is 2022 forward, because that's all I've been involved in. Over that 10-year, from 07 to current, there's been at least 3 CPA firms involved, 3 different CPA firms. So they have pieced this information together the best they can. I will be happy to email y'all the 990s if you wanna look at the draft versions. But it's a bunch of gobbledygook, because that's what it is. And, but to move forward with the dissolution, we do have to follow those.
Question, we have to pay the money, what's the count over the company?
I have no idea. So I left some contingency money in that hospital foundation account, if y'all saw that. That's just in case
Yeah, we do have to pay.
the unknown pops up.
Yeah.
But, I would like the board to ratify the decision to file 990 rather than me just make it myself, because I just don't know. All I can go on is what I know, and that's what I know.
What
And
is the
the
plan
990
of the
is dissolve
board?
the corporation.
I'm sorry?
That's to dissolve the corporation, the
The
990.
990s are the returns that nonprofits have to file on an annual basis that haven't been filed since 2007. So since I've been on the board, we filed the 1120 every year, which is a for-profit corporation income tax return, and we've been paying income tax on because we had lost our nonprofit status, but I can't say what happened prior to 22. But all we have is the compilation reports and the few tax returns we've been able to locate. So to answer Rodney's question, I don't know what kind of can of worms it will open, but we can't dissolve without doing it. So,
What is the pledge of the board with that decision following the 999? What would you recommend to the board?
I'll make a motion that we file the 990s as presented.
A second.
Motion made by Jamie and second by Denitros. Any questions? All in favor, say aye. Any opposed? Any abstain? Let the records reflect that it did carry, that we will follow the 9. What's the 999?
Form 990. And I failed to mention in my report that there is a monthly pie chart graph that reflects both clinics. And y'all help me with this, but I think, so this says the June report, but I think that's billings for May. Does that sound right to y'all? Because on the May report, it had Nina listed, and Nina quit on May 1st, so she shouldn't have had any billings in May. So it's gotta be running a month behind.
Let me see
I'm
here,
thinking
'cause
that
I have
is.
ones.
So anyway, it reflects numbers, and, I failed to mention that, I just wanted to.
And one other thing, we had tabled, Jamie, was the hour of operation. We tabled that in last month's meeting.
Well, you just tried to get them to work 7 days a week, and they told you no. There's no comment from them on that.
No, whatsoever. I just remember that we had tabled it. So do we want to talk about this more?
Just for now, because of,
Yeah.
until Terry's back, we get on solid ground again, I would say we just move on.
Item number 15, to discuss for possible action at the request of, Dr. Ron McMary and myself, that all invoices and checkbook for the Jasper Hospital District should be brought to the main office, and all of the checks.
But not sign them,
Ma'am?
but not sign them. Y'all still.
Oh,
sign
yes.
them.
Yes, and also, let me straighten this out off as well, and we take up 16 as well. And Dr. McMurray said for Jamie and I to sign the contract, and Jamie threw me under the bus again. Look at item number 16.
I'm pretty sure what I wrote is what you told me,
No,
but we'll change that.
yeah, that Jamie and I would sign the contract. And that is in the form of a motion,
That you're making,
yes,
so did you do 15 or not?
yeah, I'm gonna lump it together.
Okay.
Item number 15 and 16,
And you're making that motion?
yes, that's
Gotcha.
correct. Robert Rules of Order on the 5.1 said that the chair or the president can make a motion or a second. And that is my motion.
Second?
Second by Denitros, any questions?
So any checks that are written on the district will be signed here by either you or Dr. McMurray.
Jamie Gunner,
Or Jamie.
So what we're trying to
What we're trying-
transition
go
to
ahead.
is and I haven't even had a chance to talk to Paula about this, and this applies to the clinics as well. But we need to transition to QuickBooks
Mhm.
to where the checks are being generated based on entered invoices.
Mhm.
That's the only way we're ever gonna overcome the financial tracking burdens that we're faced with. So, you should have gotten your QuickBook login by now, you did, I guess. So what we'll end up doing is, any invoice generated to the district, including the clinics, Paula's gonna need to enter that, or y'all are gonna need to enter that, and let Paula generate the check. That's the only way we're gonna be able to track this. And to track it efficiently, because the old school way of toting that big checkbook around with us, and Deborah calling me, and Rodney calling me, and Nicole, and not that them two right there ever have called me, but those days are over.
Yeah.
This is the only way we're ever gonna get into the modern times.
And then the other thing is to be housed here, you know.
Well, there
contract-
physically won't even be checkbooks anymore,
No.
when this is all said.
It'll be in the
Right.
cloud.
But the
Yes.
contract, you know,
Absolutely.
and all that, you know,
Yes.
everything.
Yes.
It'd be much easier for all of us.
So- The end goal here is to digitize everything, because we have a mountain of paper. I think you may have already been working on some of that, Paula, but we have a mountain of paper, and I know if you've kept up with county government business, you've heard the county clerk talking about the digitization of all the old records in Jasper County, and it's gonna take them years to get it done. So before, we've added a bunch of employees with these clinics, which have just completely skewed our processes, old school processes.
Mhm.
Thank you, Dr. Pham, for saying that we've actually made a difference. But we've gotta get, before we get any further behind, we've gotta get caught up. And I don't want Paula burdened with the past. I want her burdened with July 1st forward until she gets her processes in place. And then we'll deal with the past and getting caught up from the past.
Anything
Sounds
else?
good. That's right.
All right, moving on to item number
didn't
17,
vote on that.
discuss for
Yeah,
public.
you didn't vote
Oh, we did, I'm sorry. I thought we did.
I second it.
All in favor?
on it.
All opposed? It is the same, I'm sorry, I thought we did.
You got excited.
Trying to get out of here. To discuss the possible action modification of FY 25-26 budget for Jasper Hospital District.
So when I presented y'all the budget last month, we had our workshop, and I gave you the document that showed the categories and the items. If you'll look at what I passed out on the left-hand column, there are 3 items that are highlighted. Director expenses, utilities, not clinics, and salaries and benefits. So director expenses, we had 15,000 in last month's budget. I had included the utilities for this building as a director expense. But on second thought, I wanna split that out and show those utilities here separate. So I created a category for that separately for utilities for this building. The end dollar amount's the same. It was 15,000 last month. It's 7,500 apiece now. So it's still 15,000. And we did not add home salary benefits into the budget, so now that's added in, factored in. So I wanted to make that modification. There'll be other modifications that have to be made throughout the year. As an example, the invoices for the generator at Air Rescue generators, the invoices for the driveways at Air Rescue. Those are all last year's projects, but they're not billing out till this year, so we'll have to make more modifications to this year's budget. But this will be part of that tracking process.
Chris and Jennifer in?
Chris is included on the clinical, Jennifer is not, and I didn't know till tonight what her salary was, so we'll have to make a modification. But on Chris's, we have him lumped in under primary care pavilion. We're just gonna have to play that by ear. I don't know how to do that any other way, so we'll have to track that. Paula's got a lot of work cut out for her, trying to figure out how to track a lot of this stuff.
Let me ask you something, Jimmy.
She'll figure it out.
With that being said, that wouldn't fall under last year's budget?
When it's credited or debited when the bill is paid, not when it's incurred. So that's part of the processes we need to fine tune, is if we encumber a debt in a fiscal year that's not paid for the next fiscal year, general accounting practices say you do it during the year it's encumbered. The problem is, we don't have those processes in place,
I could go with you.
if that makes
Yeah,
sense.
I see.
So for
I
now,
follow you
just for this year, if Paula doesn't run and scream and leave and say, I'll never do that again, and stays for more than a year, that she can develop those processes over the next 12 months.
The only other way to do it would be to do an accrual,
Yes,
is the only way else you can do it.
so we need to we're paying her to figure this stuff out for us.
Okay.
I like it, I love it.
Paula, if you leave a note on the door, close for business.
Okay, I'm not gonna ask you any questions.
Jimmy, can we get a motion to
Okay.
approve? This is a non-action item. Motion made by Jamie, second
Second.
by Deborah Harris. Any questions? All in favor say aye. Any opposed, any abstention? Let the record reflect that the ayes, it did carry. To discuss, item number 18, to discuss for possible action project of the improvement building community. Ms. Deborah Harris.
Okay, we've got a gorgeous sidewalk board from the back of the hospital down to the helicopter pad. And I went by this afternoon because we've had so much rain here lately, just to make sure it hadn't washed away some dirt. It has not. We have Caesar is coming by, he's gonna put grass on the sides to make sure we've got rock there. And we're going down the drive and in the ditch down at the bottom towards Thomas Road. He's gonna fix that up to where the drains do not get clogged up. And then where the rock stops, if there's any, if it doesn't go all the way to the grass that we have planted, we're gonna get new grass for that. Don't know when we're going to put the canopy over the sidewalk, but when we do put the canopy over the sidewalk, it will have lights and it will be connected to the generator of the helipad to where should electricity go out, they still have lights for that. They are moved in and everything's going well. We had a little bit of condensation occurring, and so JBC last week got up in the attic and removed some insulation to allow the heat from up in the crew quarters to escape out to stop that from happening. Over on across the street at Morrell, we did get the slab poured finally. We do not have the go ahead from the city to do the slab for Charleston, and we're waiting for a few more things that I'm gathering up for the city inspector so we can get a permit to start the build of the actual walls, roof, and all that. I did go ahead and get some quotes and prices on the material, so as soon as I know that they're gonna bless it, then we can go ahead and get the material order and start building it up. And then Alpha, they did call and I don't know if everybody knows it, but here in the next it's already happened.
Yeah.
Copper prices have gone up, almost up to 30% in electrical wiring and stuff. So Alpha got wind of that and called, and we had them go ahead and purchase all electrical wiring for all the projects, so that it kind of helps us save some money. So that came in today, and he went and put that in our warehouse for us.
Scrap prices for copper almost double what it's paying, so.
We do have, the city did get a power line ran to the job site, we do have that. And,
Did Strawberry ever mark the, he was supposed to do that 2 weeks ago. Do you know if he did?
I didn't see anything.
out there,
The one
physically
around.
go put the flag, I don't think so, I didn't notice any today.
Call him in the morning, he was supposed to do it 2 weeks ago.
Okay,
He was supposed to get with the city, get with Bob Gary and get it done.
okay.
And did Alpha ever reimburse us, Deborah, for the overpayment we made to them?
I don't have,
No, it was
I don't
credited to us.
have a clue for
They
that.
didn't reimburse us, they credited on the next invoice.
Okay.
You want me to talk about the bank?
No, hold on, hold that thought.
How are we protected against getting our coffee stolen? Are we insured?
We're heavily insured now.
And it's locked
No,
up,
let us
so
steal
they're
our
gonna have to
coffee.
tear up the building somewhat to get in there. As far as I know, is there anything else that y'all have questions on?
Thank you.
I'm gonna excuse
Have a great
myself
day.
before you do your
Thank you.
financial piece.
Go do some
Thank you,
recruiting.
thank you for allowing me to sit in, I'm learning a lot about Jasper, so if there's any point in this meeting that you're like, adios, chica, just let me know and I will
Okay.
happily excuse myself, but I appreciate you letting me.
Good to meet
learn
you.
and-
Thank you for
Learn about
introducing
it.
yourself, thank you very much.
We'll talk about the goats later.
Alright.
Jamie started that. Go ahead.
I don't know either.
I think that's it.
All right. Thank you, Deborah. Nothing we need to, approve?
No.
This is an action item. All right, item number 19, thank you for that report, Deborah and Jamie. To discuss for possible action, to remodel, of the floor, second floor on Marlin Street location.
You wanna do it or you want me to do it?
It doesn't matter.
So we talked about at last month's meeting, about going ahead and getting the second floor of Island Street, remodeled for a clinic. We wanna go ahead and move forward with that. If y'all look at this email, we're gonna talk about this in depth a little bit from our attorney. First page, second paragraph, talking about the procurement policy, he references chapter 2269 of the government code. I have not had a chance to look that up, we need to look at that a little bit for future projects. He wants to schedule a little bit of time with us to go over this, so we'll need to do that here in the near future. But unless the board objects, depending on what he tells us with regards to this remodel project, we'd like to move forward with with remodeling the second floor of the Myling Street Clinic, to prepare it for future, habitation by for a medical clinic. It may be Dr. Pham's daughter, if we're able to recruit her here successfully, which he says she wants to come. A little more enthusiastic, please.
Yeah.
She has her own mind.
I mean, you do know her, can you help
I
us?
know her, yes.
Please.
That's Dr. Fam's mini-me, just keep that in mind.
That was funny.
I just don't know if we can have two Phams in the same building. We'll see how that
That
works.
was my thought.
But hey, we'll have vertical separation.
Be upstairs.
Right, vertical separation.
She can lock the elevator.
Do you have any idea of the cost of that?
No, and Deborah and I did a walkthrough with Chris the other day, and was anybody else there, was it just us?
It was just us.
Yeah, but we have an idea of we have an idea of how to subdivide that up into both a lobby and entrance. And I think we come up with 6 exam rooms. 6 exam rooms, have the handicap bathroom.
A nice lobby
Nice lobby,
reception area.
yeah. So I think we've got a plan. Obviously, we have to see what the city does, with their inspection guys, and what they require us to do, but I think we've got a pretty good plan, we can come back with a dollar figure the next
And
meeting.
it's not gonna require a lot of demolition, so, it's gonna be pretty simple, easy going, not tear up a bunch of stuff to get it fixed, so
It's a beautiful space, I mean,
It
it's
is.
gorgeous, it's a beautiful space.
It's not gonna be much more complicated than the first floor of Dr. Pam's clinic was. It's just, it's a simple remodel, it's
I'd
not.
like to get you up there and just sit and look and read.
You're the one that's been going up there leaving the air conditioner turned down low.
No.
But anyway, I'll make a motion that we move forward with the project, with bringing plans and an estimate back to the board, hopefully next month.
Motion made by Jamie Gunner, is there a second for the second floor on Marlin Street location? Number 19.
Number 19.
Yeah. Motion made by Jamie and seconded by Nicole, is there any further discussion? If none, all in favor say aye. Any opposed, any abstained, let the record reflect that it did carry. At this time, we're gonna go into the executive session. Let us go into the executive session at 7:08.
Steve, it's gonna take